Okay, so this is the emittance testing room. This is where we usually start. Here we have our otoscope. So we have our otoscope, and then this is what we use to look into the ear, into the canal of the ear, to see if there's anything obstructing the sound from getting in the ear. And then we have this very cool machine here. So what this one does, it tests the function of the mealy part of the ear. So it tests if the eardrum is moving as it should. The ear is divided into three parts. We have the outer part of the ear, we have the mealy part of the ear, and then we have the inner part of the ear. So what we do here, this test here, test these different parts of the ear. We have this one, we call it an OAE machine. Oh, where is it? Yeah, it's on. So this one tests the inner part of the ear. The inner part of the ear has little hair cells. So this one tests if the ear cells, the hair cells are functioning as they should. Yeah, so it sends signal to the ear and then it measures the response. So once we move from the emittance room, we come here. This one, we call it the audiology booth, right? So this one has the machine that we use. It's called an audiometer. It's the machine that we use to test hearing. Yeah, it has different frequencies, different levels. We want here, what we usually do is we want to test the softest sound that a patient can hear. So we use this as the VRA because we test different age groups, from children until 13 years of age. So if it's a child, it's a bigger child, we put it like this, and then they wear these headphones or the insets, and then they use this button. If they can hear the sound, they must press this button. If they can't hear the sound, they don't press. And then if it's a very small child, maybe 3 years of age, we make them sit like this, and then we present the sound via the speakers, and then they must turn to the direction of the sound, and then we play. We use this screen, these two screens here, to show them like pictures that are going to distract them and then bring them back to focus. But when we test a small child, someone else must sit here and distract. So sometimes it takes more than one person to test one child.